what I have learned in this menopause journey is women don't talk about menopause. It's taboo, and it shouldn't be, right? And for someone like myself who went into menopause at 43, I'm kind of the younger one amongst my family and friends that have got into it. And I kind of became my own champion, I guess you can say, for them, and letting them know it's normal. And we need to talk about this. We do. We need to talk about symptoms. We need to talk about that there's options, and that we have an amazing clinic in Windsor, the B Clinic. Hi, I'm Kelly, and I have been a patient at the B Clinic for 2 years. So actually, to give you just a little bit of a history of even just on this journey with bioidenticals, February 4th of 2020, I had a hysterectomy. And initially when I went in, I was told it was going to be partial. However, when the surgeon was doing the actual operation, he ended up having to take everything because of it was a lot worse than they thought, which I'm very grateful for. But what I didn't anticipate was I would go into immediate menopause, surgical menopause, I guess they call it. And so immediately I went into menopause within a week period. With having my surgery February 2020, no one would have anticipated that March, the next month, everything shut down. So my surgeon gave me just like a package of estrogen and said, hey, just take this. And when COVID's all said and done, maybe you can go to your family doctor and figure out other medications. So long story short, what I experienced right away was hot flashes, night sweats. For someone who doesn't sweat even when I exercise, it was shocking. My emotions were all over the place, and weight gain. And it didn't matter if I was running or going to the gym or eating healthy. I just started to pack on weight, which is something when I started to speak to some of my other friends with menopause, they experienced. So after a year of going to my family doctor and just experimenting with a few different hormones, I didn't feel comfortable with the journey I was going with hormones. Hence, I Googled and found B Clinic. The B Clinic, it came up. I read about Dr. Kufian, loved her experience, love what the B Clinic has to offer, because there's a plethora of different options, right? Whether it's the bioidenticals, I love also the other options of, as I'm getting older, and if I want to do aesthetics for my face and body, I just knew that I was in good hands. So I started about 2 years ago. Because of COVID, I had a phone call with Dr. Kupian, and right away I connected with her. She was so kind. We were on the phone, right? It was a video call, and I immediately had a connection where she understood me, and nothing surprised her when I shared my last year of a journey of having surgical menopause. So immediately she put me on all the right bioidenticals, and I have to say I am 46 years old, but I am in the best shape of my life. I feel like I'm 30, which is nice. I lost all the weight that I put on because of the surgical menopause. My hormones are a little bit more balanced, which my family and friends are thankful for, even though I don't think they were that bad. But and also just my quality of life. And I come to B Clinic every 3 months, and they take care of me. They look at my levels, they do a blood test, and they identify, am I on track? And if not, like, how can we adjust? And I guess what I want to say too regarding B Clinic, what I have learned in this menopause journey is women don't talk about menopause. It's taboo, and it shouldn't be, right? And for someone like myself who went into menopause at 43, I'm kind of the younger one amongst my family and friends that have got into it. And I kind of became my own champion, I guess you can say, for them, and letting them know it's normal. And we need to talk about this. We do. We need to talk about symptoms. We need to talk about that there's options, and that we have an amazing clinic in Windsor, the B Clinic, that's able to help us. So as we age, and menopause is a beast, it is unpredictable. There's options and there's help at the B Clinic that can keep us sort of at a steady state.
Yeah. Awesome. So I know you did talk about some of the limitations and challenges you were having. Did it affect just you, or did you find that it affected families, friends, coworkers, or with your significant other or things like that? Have they made any notational changes or things like that since you started with B Medical?
Yes, absolutely. So how menopause has impacted my loved ones around. Because I really just became self-aware. I was able to control a lot of my emotions, so it didn't necessarily highly impact my family, friends. However, my husband, because I mean, he's with me basically 24/7, he definitely saw the emotional element of not being as steady. So we talked a lot, and with being on the bioidenticals, that really helped the balance. But I have to be honest, it also helped my mental health, because the people around me, I kind of hid the fact that I felt like I was in a circus emotionally. I tried to hide it from the ones around me, but just having self-awareness and being on the bioidenticals, I don't feel like even in myself, I'm struggling as much, which impacts everybody around. So, but definitely, I think that my husband definitely saw right after, he saw more of the physical. The emotional, I was able to hide it or just kind of ride the wave, if you want to call that. But I have to say, overall, the physical is what he saw improved almost immediately as soon as I started the bioidenticals.
What was your treatment plan? If you kind of wanted to go into details about like how much, how often, things like that. If you kind of went into creams, orals, things like that.
Okay, yeah. So after my first appointment with after my initial appointment with Dr. Kapan, I was given estradiol, I believe that's called, some progesterone. And we started at a low dose, and I started to see small changes. It probably wasn't until my third visit of being consistent with taking the medication that we also added testosterone, which is a topical cream. And I would say probably about month 8, I was in the best shape that I had been up into this point of, I think it was a year and a half post-surgery. So between taking the 3, the progesterone and the estradiol and the testosterone, that is where my sweet spot is, where I actually, as I've indicated before, is I feel like I'm a 30-year-old versus 46. I have energy. I actually want to work out. I'm happy on a consistent basis. So that's kind of the treatment plan I'm at with right now.
How soon did you start noticing results?
So I started to see results probably within the first couple of weeks of getting the medication. It was very little small improvements, but personally, again, from being self-aware, I knew I was improving.
How are you feeling now?
So where I am today, 2 years since starting this journey, is I'm doing really good. I feel like I'm 30, even though I'm 46. I'm active, playing lots of sports, and my hormones are, even though I have an ebb and flow, they're as if I've never had menopause, which is a good thing. So they're at a steady state, and I'm happy. And my husband's happy, my family's happy, and so that's all I can ask. And I look forward to continuing with the B Clinic in the future.
How has this made a difference for you, your family, friends, life?
So coming to the B Clinic and starting the bioidenticals has changed my life. That's given me hope, because after having the shock surprise that, hey, we basically had to take your reproductive system, you're going into immediate menopause, it was very scary. I didn't know what to expect. I felt in the dark. But coming to the B Clinic and getting educated and given hope by saying, listen, it doesn't matter, there's treatment plans out here and we're going to guide and lead you, that has given me hope and confidence that where I am today and how I'm feeling because of the help of the B Clinic makes me happy. And I have hope, and my family and friends are now believing in it, especially my sisters and my female friends, because they're seeing the differences in myself, and so they want to get on it too, which is exciting, right? And being able to share knowledge it's what it's all about. And so, and having them come to the B Clinic is also excellent, because they're going to experience what I feel